Okay, so and as we said, the Final Exit Network. So Kevin Bradley, he created an online course for the right to die, American Humanist Association Center for Education. He has testified on the behalf of medical aid in dying in 2016 for the Minnesota State Senate, and co-founded the Interfaith Clergy for end-of-life options. And Kevin currently serves on the Final Exit Network as a speaker, exit guide board member, counselor, and editor of the Good Death Society blog. Final Exit Network is the largest national organization dedicated to supporting end-of-life freedom for anyone of sound mind facing intolerable illness. Okay, so I'm going to stop sharing and turn it over to Kevin.
All right, good. So I'll just jump into it. And thank you, first of all, thank you for inviting me to this. As Bill mentioned, I am part of the Final Exit Network Speakers Bureau, but of course, all of our public speaking engagements have been pretty much shut down, like a lot of things are. So we are doing Zoom meetings, and who knew that a year ago, the word Zoom video would be part of our conversation on a daily basis. So I will jump into it. My one request is that if you have questions, if you could hold it until the end. There's a good chance I may answer some of your questions during the presentation, but I welcome any questions afterwards. So this is our very abrupt beginning that I typically will open a in-person engagement with. Where do you want to die? Now, because of the Zoom, I'm not going to sit here and wait for people to respond. But the basic question is that almost invariably, at least 80% of our audience people will say, well, of course, I want to die at home. Although I have to say that I had a speaking engagement in northern Minnesota a few years ago. And when I asked this question, a lady in the back of the room yelled, on a zip line with my hair on fire. So I thought, well, okay, that's one way to go out. So, but 80% of the people do say they want to die at home. But the reality is that the 80% of us who want to die at home, 60% will die looking something like this. 20% of us will die in a nursing home, and we may or may not still have tubes stuck in ourselves. Well, if you do the math, that means that only 20% of us will actually die at home, even though that's what we claim we want. Well, the question then is, well, why is that? Well, the reason for that is because we're not prepared. Some more trivia for you. I mentioned the 80% of us will probably die in some kind of an institution. Here are some statistics that kind of blew me away when I first learned them. 20% of us will have surgery in the last month of our life. And I wanted to add to that, even if we don't want it. 10% of us will have surgery in the last week of our life, even if we don't want it. And the reason that happens is because we're likely unconscious and we don't have an advance directive or anybody speaking on our behalf. Less than 25% of Americans today have an advance directive or a POA, which is power of attorney. And I need to mention, excuse me, both of those things because having an advance directive by itself is not enough. Having a piece of paper, you can hand it to a doctor, and I used to work in a hospital, and I have seen doctors say, this is old. The document in their hand will be old. It's arbitrary as to what they think is old. And they say, there may be a new one. So I have to abide by hospital protocol and override this advance directive. The one way to make sure they don't do that is to also have somebody assigned as your power of attorney who can basically stand up for you and say, okay, doctor, I am the power of attorney. This is my mother's advance directive. You will abide by this or I will own this hospital next year. Are we good? I have seen that kind of thing happen, and sometimes that's necessary. Okay, 40% of nursing home patients with dementia will receive a feeding tube. Often, even if 3 years ago, before they had dementia, they said that's the last thing they want. The reason for that is because nursing homes are not medical facilities. They don't have a doctor on staff. and they have their own policies, especially if they're owned by a church. And we will get into that later. The bottom line here is that 50% of us will be unable to participate in our own end-of-life decisions. So we need to have someone speak for us, or we need to make it very, very clear what we want. Another little trivia here. Medicare is often part of our daily discussion. You know, which politician's going to promise to do what? Are they going to take it away? Are they going to add more? But a little known fact is that the vast majority of Medicare is spent in your last year of life. And of that, most of it is spent in the last 30 to 60 days before you die. Even from purely financial perspective, if you think about the statistics I gave you a moment ago, if everybody who has surgery in the last 30 days but did not want that surgery, if their wishes were followed by the medical community, we would save a whole lot of money on Medicare. All they would have to do is follow the directives that the patients actually want. And there'd be a lot more money left over for spending on people who do want that surgery. I apologize, I got a frog in my throat here. All right, so what are the current options in all states in the country? Well, I'm going to throw a term at you here. If anybody's a mental health professional, you'll understand this. First, you have to decide whether or not you are mentally capable. And that means that somebody with the professional credentials or the average person even could say, yes, that person is generally with it mentally. They're not currently being institutionalized. They're able to pay their bills or whatever. Different states have different rules as to what it means to be capable. But let's assume for the moment that you are considered a capable human being able to make your own decisions. If so, your options are you can refuse treatment. If you have been given treatment, let's say you were brought in after an accident and you couldn't speak for yourself at the moment, but then you wake up, you have the right to pull that IV out of your arm or to just say, stop whatever you're doing. You also have the right to simply stop eating or drinking. And that's called VSED, which stands for voluntarily stopping eating and drinking. It sounds a bit harsh because you essentially starve yourself. However, there are medications that can help that process. But those are the three options available in all states in the country. Now, if you are determined to be incapable, then you have your directive or your power of attorney or your agent. It's all the same thing. They can act on your behalf, and they can, on your behalf, refuse treatment. They can make sure that any treatment that's already been started is discontinued, and they can discontinue the nutrition and hydration. So it's the VSED. It's just that in that moment, they don't call it voluntary because you're not speaking on your own behalf. So those are the current options in all states. If you're capable or incapable, those are your options. Now, I wanted to jump in here because, the nature of this group, the Right to Die movement has some very heavy hitters in its history that were humanists. These are the two guys that made a big press. They were very well known back in the days that they used to call the age of free thought, back in the 1920s or so, or I'm sorry, the late 1800s. The guy on your left is Felix Adler. The guy on your right is Robert Ingersoll. So I just want you to know that if you look those guys up on the internet, you'll find all kinds of things about them. But those were out and out humanists. And by the way, both of them came from very religious families. I forget which one of them, but one of them's father, Felix Adler, I believe, his father was a Jewish rabbi. And his family came to America in order for him to start a temple in New York. And Robert Ingersoll's father was also a fairly famous preacher. And his daughter, and I forget her name offhand, but his daughter became a fairly famous women's rights to vote advocate. So you have some very strong humanist heavy hitters in history. Another humanist that you may or may not know about is Derek Humphrey. He actually probably refers to himself as an atheist, but there's a lot of gray area there. But Derek Humphrey was kind of the founder of the movement in America in more recent days. By the way, the reason that Felix Adler and Robert Ingersoll's movement didn't really grab hold is because we had these two little incidents called World War I and World War II. And so because of the world wars, the impetus for making the right to die legal just kind of went away for a while. Elizabeth Kubler-Ross sort of got things going again with her book on death and dying. If you don't know about her history, she was really the mother of the hospice movement, and she really kind of started the conversation again with her book in 1976. All right, so while that was going on over here with Elizabeth Kubler-Ross, Derek Humphrey and his wife lived in England. They were British, and in 1978, he wrote this book called Jean's Way. That's Jean. Well, Jean had breast cancer, and after suffering with breast cancer for several years, Derek helped her end her life with a prescription drug, and he wrote this book about it. He actually was a journalist by trade, so it came easily to him. He wrote the book and instantly became locally famous, at least in the United Kingdom. So after he became somewhat famous for his book, Jean's Way, the success of that book allowed him to move to America, where there are just a better environment for what he wanted to do. He had decided, because he got so many phone calls and letters saying, how was this process for you? How did you do this? How can I do this? So he decided to really kind of dedicate the rest of his life to helping people end their own life if they were in a situation like that, or maybe help a loved one. Well, that crosses a whole different area when you help somebody. So he moved to America and he started the Hemlock Society in 1980. You may be familiar with that term. That happened to be in Santa Monica, California. A few years later, he wrote the book Final Exit, and that's where we get our name. So that's kind of the history there. So the Hemlock Society eventually grew, and it changed names. It absorbed a couple of other smaller organizations because the word got out. Derek was out on a world tour and speaking and writing and all kinds of things. And then eventually what used to be the Hemlock Society grew until it split. In 2004, the organization split into what is now Compassion and Choices and Final Exit Network. Compassion and Choices focuses strictly on legislation. And by that, I mean their job is strictly to get medical aid in dying laws passed. Currently, I think there are 10 states plus Washington, D.C., where it is legal. And that started in Oregon. Final Exit Network, which is sort of, we consider ourselves to be the direct line back to Derek because Derek is not involved in Compassion Choices anymore. He is still on our advisory board for Final Exit Network, along with Faye Gersh, who also was with Derek at the very beginning in 1980. While Compassion and Choices is doing their legislation, Final Exit Network continues to work directly with clients who are facing intractable pain or illness, and they want to end their lives. So we provide the guidance and support to help them decide whether or not to do that and to direct them to the resources that will make it peaceful and painless. All right, I need to tell you a little bit about why can't we all play together in the sandbox together. So I wanted to let you know, in case you're not aware of this, all states follow the Oregon model. So this list of requirements is based on the Oregon model. There are some states that are slightly different, and we can talk about that if you have questions. So I'll just read this briefly, at least highlights. You must be an adult legal resident of your state. And in some states, they tell you how long. So a lot of times you have to be there for at least a year. So you can't just up and move to a state and then suddenly be allowed to get prescription. No, you have to be an adult legal resident of the state by your state's definition as to how long. You have to have been diagnosed with a terminal illness, which means you are likely to result in death within 6 months anyway. That is the legal definition of terminal. And by the way, That is kind of that's also the requirement to be eligible for hospice care. It's kind of a Medicare thing. Once a doctor says that I think you are likely to die within 6 months, he signs a piece of paper, and then suddenly Medicare steps in and pays for everything. The third point there is that you must be able to self-administer. Well, most times that involves you swallowing some pills. If you're wondering, well, what about people who can't swallow? Yes, there are ways around that. But the vast majority of times, you need to be able to self-administer, and that means swallow a pill. You need to be able to make 2 oral requests to the attending physician separated by at least 15 days. Now, that 15-day waiting period, that's one of the things that I believe is different state to state. But you need to ask the attending physician orally, I want the drugs to end my life. And then you have to wait either 15 or whatever days, and you have to say it again. You also then, during that time, moving on down to the last bullet point, you must provide a written request to the attending physician. It has to be signed in the presence of 2 witnesses, and at least one of those witnesses cannot be your relative. That's just page 1. Now, that's what you have to do. The the prescribing physician, the attending physician who's going to give you the prescription medication, they must confirm the diagnosis and your prognosis with a consulting physician. So now we have 2 doctors involved. And together they need to determine whether or not you are truly, fully capable. Remember what we talked about, the word capable means, of making this decision. Either of the physicians, either the attending or the consulting, if either of them suspects that your judgment is impaired in any way, whether it's being coerced by relative or whether you have early dementia or something, then you must by law be referred to a psychiatrist or a psychologist for an examination. All right, now let's say that so far you're good, you're qualified, and no problem. The physician also must confirm with you, the patient, that you are indeed acting voluntarily. You're not being coerced in any way. And so they bring your family in, make sure everything is good there. They must formally offer you the option of changing your mind. Legal terms, they call that rescinding the request. Well, I guess it's not a legal term, but so if you change your mind, they must give you a piece of paper saying, do you still want to do this? They must also, by law, they are required to advise you on the use of the medication that you're going to be using and its potential side effects. They also must inform you of feasible alternatives. And this one's kind of tricky because, well, what's feasible? It's depending on where you are in your situation. The doctor may say, well, no, I don't think you should do that because you can do this. Well, I say, well, what if you don't want to do that? So it gets in gray area. And the last bullet point on this list is that the physician must ask you to notify the next of kin of your request. So if anybody in your family says, no, I don't want that, you may or may not be allowed to take your own life or to end your own life, even in a state where it's legal. Or first of all, most states it's not legal anyway. So these are just all the requirements for where it currently is legal. All right, so Final Exit Network saw this situation, and Final Exit Network said, well, there are way too many hoops that you have to jump through. And first of all, it's not legal most places. And when Final Exit Network started, it was only legal in one state, Oregon. So Final Exit Network boils all of it, the requirements, down to one mission statement, or to this vision, actually. So we believe that any competent person, and I remember what we meant by competent, so you need to be mentally competent, suffering intractable pain or illness should be allowed to end life on their own terms. And a key word there is intractable, which means it cannot be treated with reasonable means. So if you're suffering from any pain or illness, you've been suffering for it for a while, and in your opinion, it's intolerable, you can come to Final Exit Network and we can help you discuss your options. So with that in mind, this is our mission. We educate people on how you can end your life peacefully and painlessly. We also will offer what we call a compassionate bedside presence, and that's just what it sounds like. We will come to your home and we will sit with you as you self-deliver. That's the term that we have come up with, to self-deliver. And if you want to do this and you find people fighting you, we will step in. We have our own legal counsel, and we will go to court for you, and we will defend your right to choose. All right, so who are we? Well, we are about 3,000 members nationwide. And of those 3,000 members, about most of our jobs and our tasks are performed by about 90 volunteers, including many. We have physicians, we have psychiatrists, attorneys, as I mentioned. These are just a few of the professions, but a lot of our tasks and volunteers are done by people who don't necessarily practice these things for a living, but they're just very dedicated people. And then they go to specialized training so that they know what they're talking about. All right, you may or may not recognize this gentleman, Jack Kevorkian. He's another humanist, and I wanted to throw in here because I did not realize until I was creating my course for the American Humanist Association that Dr. Kevorkian was awarded the American Humanist Association Hero Award in 1994. And it just happens to be that one of the people I work with in Final Exit Network actually was the psychologist who was the therapist for Jack Kevorkian's first patient. Her name was Janet Adkins. And as I mentioned, one of the people I work with in Final Exit Network was Janet's therapist. So we have some connection there. And you have some connection with him as your humanist organization. So I wanted to briefly touch on some of the things that have happened in the movement. You may recognize some of these names. I'm not going to spend a lot of time on the details. If you have questions about who these people are, why they're important. But it kind of started back in 1975 with Karen Ann Quinlan. There's a big legal case. One of the positive things that came out of Karen Ann Quinlan's case is that really started the advanced directives, so that all people have a piece of paper that they can force their will to be done. So you move to the right and go down to the bottom. Nancy Cruzan was another one. More legal things were being done. So basically, each of these people involved, their situations and their cases resulted in today we have more legal options. You have power of attorney, medical power of attorney, advanced directives, agencies. All these things have come out of all of these pioneers in the movement. So that's just a general timeline, and we can go back to this slide later if you have questions. I just want to be mindful of the time right now. So Jean Humphrey, I mentioned. Jean Humphrey, that's where Derek's wife came in. That was actually right before Karen Ann Quinlan. And then the book was Jean's Way, I mentioned. And then the Hemlock Society, that's where these jump in, just so you can see where Final Exit Network fits into these the timeline. The Final Exit book came out in March of 1991. And you see it was right after Janet Adkins died. That was Dr. Kevorkian's first patient. And then Final Exit Network and Compassion and Choices split into their current organizations in 2004. So what makes exactly Final Exit Network different than Compassion and Choices? Well, I've already touched on it a little bit, but some really key high-end things are, in order for Final Exit Network to help you, you do not need a medical prognosis that says you will have 6 months or less to live. One of the reasons that is important is because let's say you come down with dementia, and you also know that there's a very good chance based on your family history that you may get cancer. Well, by the time your cancer gets to 4th stage and you are within 6 months, your dementia may have progressed to the point where you're no longer mentally competent. So there's a conflict. So Final Exit Network came up with this qualification right away that says, if you, let's say you have dementia and you have stage 1 cancer, well, the doctor is going to say you could live for years like this, but you don't want to take that chance. You can come to Final Exit Network and we will show you a peaceful, painless, and certain way to end your life even if a doctor could say, well, you could live for 10 years like this. Our position is that's up to you to decide, not the doctor. The next thing is there are no prescription medications involved. You don't even have to have an attending physician. There's no pills, no nothing. The other thing is what we do, believe it or not, is legal everywhere. We are very, very careful to work well within the law. Now, the reason this is possible is, we don't generally like to use the word because it has all kinds of connotations, but the fact of the matter is, suicide is not illegal. Assisted suicide is, and that's where the gray area is. So, for example, if I come to your home as an exit guide, I can show you, or I can instruct you, or I can point you to the resources, but I cannot buy anything for you. I cannot provide any equipment for you. I cannot touch anything in your home unless you want to offer me a cup of coffee. But I cannot provide any physical assistance to you whatsoever. Otherwise, I would be risking being arrested for assisted suicide. So those three things: you do not need to be considered terminal. You do not need a prescription medication. So doctor, don't decide this, you do. And what we do is legal in all states and Washington, D.C. Now, there are some qualifications. Again, this whole thing about being competent. You must be a mentally competent adult. You also have to have, and I'll explain this a bit, but the way our guidelines say is you have to have existing or reasonably anticipated unbearable suffering or intolerable quality of life with no reasonable hope of improvement. Now, this sounds a little bit like some legal gobbledygook, but notice there it's reasonable. Well, who decides what's reasonable? From our perspective, you are the best judge as to what is reasonable for you. Now, there are some gray areas. You can't say, oh, I have a bad headache today, I want to die. Will you help me? No. Or someone can say, I just broke up with my boyfriend and I'm devastated, I want to die. Will you help me? Again, no. We don't deal with situations where it's just momentary depression. We also don't deal with situations where your only diagnosed illness is a mental illness. There are some people in Final Exit Network that might support somebody who wants to end their lives because they've been suffering from depression for 10, 12, 15 years. However, in order to protect the organization, we just can't go there yet. Maybe someday we'll be able to do that. But right now, given in our lawsuit crazy country, we simply have to say if your only situation is clinical depression or addiction, call me. I can talk to you. I'm a licensed counselor, but as a representative of Final Exit Network, no, we cannot suggest that you end your life. Right. The other thing is you at least need to demonstrate to us that you are aware of your treatment options. So we will ask you, have you talked to your doctor? Have you considered chemotherapy? Are you at least aware that there are other options out there? Because one of the things that we do is we stay on top of the research. We know what clinical trials are out there. And some doctors don't, believe it or not. I was surprised to learn this. And that's because many doctors, they have a relationship with a particular supplier, the pharmaceutical company. And until their pharmaceutical company tells them it's okay, they're not necessarily aware of all the clinical trials. So we stay on top of that kind of thing. And the other thing is that you must inform, or at least be willing to inform your family of what your plans are. And this is kind of important to us because sometimes I am asked, have we ever been sued? The answer is yes, we have been sued. But in every single case, it's always from a family member who was left out of the loop. And they were ignored, or they simply didn't know until after the fact that Uncle Joe or their parent or even a child, an adult child, had chosen to end their life, and they didn't tell this person because they didn't know how to have that conversation, or they were afraid of being talked out of it, but for whatever reason. So that's our basic list. And there's also one more thing. Again, you must be able to self-deliver. And in our case, we use what we call an inert gas method. And the long and short of it is, instead of breathing regular room air, which is about 87% nitrogen, I think it is. I have to look that up. We help you create a hood attached to a tank of pure nitrogen so that you breathe the pure nitrogen, and that will starve your brain of oxygen. You will fall asleep in about 1 minute, and your heart will stop in about 10 minutes. And 20 minutes later, it's over, completely peaceful, completely painless, and absolutely certain. And those are the 3 criteria. I do need to mention this. We mentioned that it can't just be on your word. I did say that you don't need your own personal attending physician. However, you may remember on one of my earlier slides that we have a number of physicians in our organization. Well, some of those physicians are members of our medical evaluation committee. So you would have to pass the medical evaluation committee, and they would determine whether or not, yes, your records show that you have been diagnosed with an illness. So you can't just call us up and say, I have cancer. You need to somehow show some documentation of that, and you have to have a signed statement. So what that signed statement must say is how exactly your medical condition meaningfully reduces or will reduce your quality of life. And you need to show some examples of how your life has changed because of your condition. Now, remember, it doesn't have to be a terminal condition. For example, you could be diagnosed with multiple sclerosis. Well, you could live that way for 20 years. But what if you're a professional athlete and the meaning of your life is gone because you can no longer run? Well, that's something to be considered. Some people would say, well, you're no longer a professional athlete, but gee, you could now go out on the lecture circuit and you could have a happy life. Well, that may be, but Final Exit Network thinks that should be your choice. You also have to include in this personal statement, what exactly are your values? As I just mentioned, maybe you're a professional athlete and now you're not. And that is very, very important to you. Simply breathing is not enough for you. And if that's the case, we don't necessarily say that, oh, you're disqualified because you're still breathing. And the other thing is you have to very clearly say what it is you want from Final Exit Network. I don't have personal experience with this, but there have been rumors around that people have asked us to come to their homes and shoot them. Well, no, we're not going to do that for all kinds of reasons. But you have to very clearly say what it is that you want. But in practical matters, what that comes down to is, in fact, I was just on an exit visit a couple of weeks ago. And before we start our visit, or the first visit is referred to as instructional, we simply say, why do you want us to be here? Now, by then, everybody knows because you've gone through several interviews. Everybody knows, we've seen your records. But if I come to your house, I need to hear you say to me, I want you here because I'm in this incredible pain. I don't want to continue living like this. I have thought through my options, and I want you to show me how to end this. I just need to hear it from you to make sure you're not being coerced. Now, there's an added thing here. I talked a bit ago about, let's say you have dementia and cancer. Well, you have a window of opportunity. If you happen to have something like early stage dementia, you must do this while you are still competent. With medical aid in dying, if you happen to live in a state where that's legal, once dementia has taken you to the point where you're no longer competent, you may very well be dying of cancer, but you cannot get help because you're no longer competent because your dementia has already put you past that window of opportunity. So if you have early stage dementia, you may need to leave some good time on the table if you want to control your end of life. Likewise, if you have a degenerative neuromuscular disease, I mentioned, for example, muscular sclerosis. Well, there's muscular dystrophy, there's Parkinson's disease, there's ALS, there's a whole list of 10 to 20 different kinds of diseases that could be wasting away your body and wasting away your abilities. And if you have one of those, you must also think about your window of opportunity, because you may have heard me mention the method that we use is called inert gas. Well, that means you have to be able to open the valve on a tank of gas. So what we typically say is, people say, I don't know if I'm strong enough to do what I need to do. We have three basic questions. Number one, can you carry a gallon of milk from the floor to a table 2 feet away? That's one thing. That's about the weight of the tank. Can you open a jar of jelly or peanut butter or whatever from the store, brand new, never been opened? Can you open that jar? Or do you have the means to do it in some way? You don't have to do it with your bare hand. You can use a wrench if you want to, but the question is, can you do it? Because if you no longer have the manual dexterity to open a jar of jelly, then you probably don't have the manual dexterity to open a valve on a tank either. And so we cannot do that for you. So those two things are your window of opportunity. Are you still capable? And is that capability possibly going to go away because you have dementia? And are you physically able to construct this equipment currently? And is that ability possibly going to go away? So those are just considerations to have. Now, so what exactly does Final Exit Network do? Well, we very carefully screen everybody who applies, and we provide counseling and referrals even for people who do not qualify for what we call exit guide services. We will help you get help. We have a whole referral network of psychologists, psychiatrists, we have doctors, and one of the things I simply say is, where do you live? Because if you live in a state where medical aid and dying is legal, maybe that's your best option. And whatever you decide to do, we will support your decision. We're not here to talk anybody into, using us. Quite frankly, we don't care. We are simply here to support you, whatever you want to do. What we will not do is we will not encourage you to end your life. We won't necessarily discourage you either. We don't have any stake as to whether or not you use our services. We will not encourage you. We will not say something like, oh, you would be much better off, or, oh, why spend all that money? You should leave that money to your children. No, we don't have those kinds of conversations. This is entirely up to you, and we just give you the information so that you can make an informed decision. As I mentioned several times, we will not provide the means. We will direct you to get the means, but we cannot purchase anything and we cannot provide anything. And we cannot provide any kind of physical assistance whatsoever, unless maybe if you invite me into your home, I might open the door for you, or something normal, but I'm not going to open the valve. I'm not going to lift a tank closer to you. I may be able to suggest ways for you to do things that make it easier, just because in those situations, you're often, it's a very emotional time. And so you forget things like, if I would move my chair 2 feet this way, then I could do these other things. And so I might suggest those kinds of things, but I will not move that chair for you. All right, so we're almost done here. So the process is, and some of these things I've touched on before, you call us and you then submit an application and your medical records. We have trained volunteers, and some of them are doctors and psychologists, but some of them are just lay people who have been trained specifically for this, and they will review your application. We have a medical evaluation team I mentioned earlier that will also review your records. And if the medical evaluation committee says, okay, these records look legit, then an exit guide is assigned. We call them a senior and associate, but the senior exit guide is assigned to your case. They see your records. They see that the medical evaluation committee has said, yes, these records look legitimate. Then the senior exit guide will call you and say, tell me about your situation. The senior exit guide will then select an associate exit guide based on geography and other things. The associate guide will then call you and tell me about your situation. Those two exit guides will then confer with each other and say, okay, we're on the same page, we agree, we can move forward with this. The senior exit guide will then send you a shopping list, tell you what you need to buy and how you can get it. After you get all of your equipment, you call your senior guide, and then the senior guide and the associate guide will both come out to see you. And it's always two of us, the senior and the associate. Sometimes you might get two senior guides, depends on who's available. But so we will come out and for what we call an educational visit or an instructional visit. And it's during that time where we will physically look at your environment. We will meet all the people involved. We will show you how to assemble the equipment necessary. And then if after that educational visit, you want to move forward, then and only then, you will decide when you want to exit and whether or not you want us to come back. In many, many cases, especially if there's family members or close friends there, we never see you again after the educational visit because you've got the education, you understand how easy this is, you understand your anxiety is all gone, and you have somebody else who can sit with you. But there have been cases where family members, even though they're supportive, they don't want to be present. And we don't push that. And so we will come out and sit with you during your exit. And the whole process for us being there could be as little as 30 minutes. As I mentioned, it's very quick, it's very painless, it's very peaceful. And so we will come in. It could take several hours because you may want to sit around and chat for a while. And that's fine. But my point here is that once you decide to start this process, it's over in about 20 minutes, and then we will leave. All right, I need to throw a couple things in here because one of the things that you may have mentioned seen from my introduction is that I am an ordained minister. I'm ordained in the United Church of Christ. I used to work as a chaplain at several hospitals and also for hospice organizations. And people often are surprised that I do this work with Final Exit Network because I'm a minister. And they say, how can you do that? Well, there's a lot of different stories there, but I wanted to tell you that when I was first learning to be a chaplain, I actually had an internship at a VA hospital. And that is where I first saw people saying, well, what you're doing is thwarting the will of God. People would come in and they would say, don't you dare, do that to my husband because, my scripture says you're not allowed to do that. Well, long and short of it is I can tell people, okay, how did you get to the hospital? Did you call 911? Did God call 911 for you? Did you not thwart the will of God by picking up the telephone? Did you ride in an ambulance? Was God driving the ambulance? I mean, there's all kinds of ways I could go on that conversation. But the point is, anything we do today, a person could argue thwarts the will of God. Now, conversely, I also saw people say, you must do absolutely everything you can to help my mother, father, whatever, because life is precious and God, it's a gift from God. And so I've actually heard people literally quoting the same scripture with complete opposite motivations. One is don't do anything, and the other is you must do everything. And they both claim to be doing it because of their religion. So the whole thwarting the will of God argument, I think I can pretty much argue there. That's what I mentioned. Now, another thing is, in fact, I just saw a thing about this on our Facebook page the other day. And I would really appreciate it, by the way, Bill, earlier you talked about having relationships with believers. If you get into conversations with them, how do you have that conversation when it comes to this? Well, one way is to know where they're coming from. Well, one of the most vocal groups that opposes medical aid and dying, and they certainly oppose Final Exit Network, is the Catholic Church. And they have this thing they call Redemptive suffering. And in my opinion, and I've been to seminary, I've got a master's degree, I know all the theology, I can quote scripture and verse from half a dozen different religions. In my opinion, this is a very, very bad translation of this verse. And it comes from the 2 Corinthians, which, by the way, is Paul's letter to the church in Corinth, and where he says, when we are made to suffer, it is for our consolation and salvation. Well, our good friend Pope John Paul II decided to interpret that in a way that says, if you suffer, it makes you more like Jesus. Now, I don't follow his logic. I never did. But I just want to let you know that this is where they're coming from. It's this idea of redemptive suffering, that the more you suffer, the more you're like Jesus. So that's just so that you know. However, if I end up talking to a Catholic and they say, how can you do this? I will often just ask them a basic question. What do you think the number one reason is that people give for wanting to end their life? And they will often say, well, it's the suffering from their pain, of course. Actually, that is a myth. It is not. Pain is not the number one reason people want to end their life. Check this out. The number one reason why people want to end their life is simply because they have lost their autonomy. They can't get around. They can't move for themselves. Next is they're simply no longer enjoyable. I mentioned the idea of an athlete. If someone gets all of their meaning out of life, out of running marathons, and suddenly they can't run a marathon, life is no longer enjoyable for them. And the third one is the loss of dignity, and that's where we get the term death with dignity. But notice where pain comes in. It's way down on the list. The fact of the matter is, today's world, you can probably manage your pain in most cases, not all, but most pain can be managed with modern medicine. But the fact of the matter is, pain control is not even in the top 5 list of why people might want to end their suffering. All right, I'm going to throw this at you just because we talked about earlier, and Bill specifically, asked me to, bring about the church's involvement in this. If anybody ever says, well, it's against Scripture, I say, show me. Show me where Scripture says suicide is illegal or is against God's will. The fact of the matter is it's not. There are actually 6 verses in what we call the Old and New Testament that even mention someone taking their own life. They never talk about, it's never called murder. It's never called suicide because that term didn't even exist back then. Now, the first 5 here are all from the Old Testament, and these are all various kings and whatnot. And the third one down is actually my favorite because I grew up going to Sunday school, and I heard the story of Samson, Samson and Delilah, or Samson with the long hair. Well, the story there, in case you don't know it, is that Samson was captured by the enemies, the Philistines, I think it was, and he was supposedly chained between 2 pillars, and they cut his hair off. Well, eventually his hair grew back, he got his strength back, and then he pulled down the pillars on his captors and killing them all, including himself. Samson committed suicide, but he's considered a hero. All of these people committed suicide. But if you go back to your scriptures, anybody, and you look these up, none of these scriptures say that what they did was a bad thing. It is simply reported as something that they did, not that it was a bad thing. Now, the last thing I'll talk about here is people will often say, well, what about the 6th commandment? Thou shalt not kill. Well, thank you, King James, but that's not what it says. The King James Bible had an incorrect translation. The original translation specifically said, thou shalt not murder. And the difference is very important because in the original Hebrew, the word murder was very specifically defined as the deliberate taking of another's life with malice. And each word is very carefully chosen. You must be taking something. Well, taking is an act of violence in the Hebrew language. If I give you a book, you don't take it from me. If I give you a book, you are receiving it from me. In order for you to take something from me, you have to be doing so against my will, or it's not considered taking. It's considered something else. But language has changed, and so we've lost the meanings. The other thing is, it must be another's life. Suicide is not murder because you are not taking somebody else's life. That's just the fact of the language that it was written in. And the other thing is with malice. Even if you were assisting somebody in their suicide, and I have seen many patients sit with their loved ones in hospice and in hospitals, I have yet to see anybody there who is doing any of these things with malice. It's the most loving moment. Birth and death are the two most compassionate moments I've ever witnessed as a chaplain. So by that definition, there is no murder. It's not taking, it's not another's life, and there's no malice involved. So no, I'm sorry, it simply does not violate the Sixth Commandment for those who care. All right, so one question I get is, well, this is all fun and good, and it's good information, but I'm healthy. Why should I join Final Exit Network? Well, the reason that we would like you to consider joining us is because the more people that we can show our members, the more credibility we have with the press. I've gotten phone calls saying, well, how many people are in your organization? If I say, well, we've got 10, oh, they don't care. But if we've got 3,000, which we do now, then they start saying, oh, there's something to this. Well, I'd love to be able to say we have 30,000 or 130,000. So there's strength in numbers as to just being allowed to have your name in our membership rolls. The other thing you get access to is Final Exit Network has a partnership with this thing called the U.S. Living Will Registry. Unfortunately, you could go into a hospital, actually, let me take that back. If you go into a hospital where your physician does not have admitting privileges, they may not have your records, including your advance directive. So if they don't have your record, they don't know what your advance directive is, and they may not do what you do. However, if you've ever been in an emergency room situation, one of the first things they do is they look through your wallet because they want to find out what your blood type is, and they want to see where you live, and they want to see your insurance information. Well, one of the things you can do through Living Will is they will send you a card for your wallet that says, okay, Dr. So-and-so, go to this website. Their advance directive is online, and you must follow it. So if you become a member of Final Exit Network, you automatically become a member of the Living Will Registry so that your advance directive is immediately available for anybody who has an internet connection. All right, so we're about done here. What can you do? Well, whether or not you agree with Final Exit Network, my request is that you somehow support any organization in your area that is fighting for your right to a death with dignity, whether that's Medical Aid and Dying or your local chapter of the Hemlock Society or something. Just reach out, find out who in your area is working on this and say, okay, this is something I've decided I want to help with. What can I do? If you want more information, get a copy of the book Final Exit by Derek Humphrey. It's online. You can just Google Final Exit and it'll come right up. It's PDF. You can download it in 5 minutes. The other thing is I really, really, really want to encourage you to make sure you have a durable power of attorney for healthcare. Remember, as I started this talk, it's not enough to have an advance directive. You must have somebody assigned as your power of attorney who will make sure your advance directive is enforced. Lastly, and perhaps most importantly, please talk to your family. It may be the most difficult conversation you've ever had, but probably the most important conversation you've ever had. Make sure your family knows what you consider tolerable and intolerable for you when you're facing your last hours and weeks. So wrapping up here, I want to let you know that Final Exit Network is offering a free 1-year membership. By the way, our paid membership is only like $50, so it's not that big of a deal. But for participating in this Zoom session with me, we are offering you a free membership. All you have to do is go to that email address at the bottom. It's finalexitnetworkcontact@gmail.com. give them your name, tell them that you were in this Zoom session, tell them the organization, and they will sign you up. What that will get you is our quarterly magazine will come to your inbox 4 times a year, a professionally done magazine, and then you just have access to what's going on. The other thing is, I mentioned earlier, actually Bill mentioned that I'm the editor of our blog. Another thing you get is you have access to our blog, and this is something fairly new because it was developed completely separately. So if you care, you can go to our website, and on the news and events tab, you can see there's a speakers bureau, which is how I was reached, but there's also the Goodness Society blog, and you go there and then you can subscribe. That's totally free anytime. That is not connected to FEN membership. So go there and subscribe, or if you want, get a hold of Bill, or you send me an email. Bill, you're welcome to share my email address with anybody who wants to, and I will subscribe you because I'm the editor. So I have a quick question for Bill, if you're not muted. Before I just need to make sure I remember this. I need to know how many people attended this session because we just like to record the numbers. So that question's out there. Don't let me go away before getting that information.
Yep, there's 17 people plus yourself.
Okay, cool. All right, that's my presentation. That's the website, finalexitnetwork.org. It's a fairly new refresh of our website, and I'm available for any questions.
Well, I wanted to say thank you, Kevin, for the presentation. It was very informative. And if you stop sharing your screen, I think.
Sorry.
No worries. I did paste a link to the Final Exit Network contact email so people could copy and paste that more readily. And who has questions? Brian?
Hi, Kevin. I don't really have a question, but I just wanted to say that my late mother had scleroderma, which is a disease that can affect your lungs and can make it like the end of your life to where you don't breathe well and you basically suffocate. So that was really what reassured her was knowing that, she became a member of the Final Exit Network. She had a plan, and it really gave her peace. Now, fortunately, she did not end up passing that way, but she was all prepared, and it gave her a lot of comfort knowing that she could avoid that if needed. So,
thank you. I'm glad you mentioned that. Something I did not mention is that just like medical aid in dying, a little known secret is that most of the people who get their prescriptions end up, I don't know most of it, but not everybody who gets a prescription ends up using it. Likewise, not everybody who I go see as a Final Exit Network person ends up doing that. Is simply knowing the option is there gives them peace of mind. And some people get better, frankly. I used to work in hospice care, and it is not particularly rare for somebody to graduate from hospice. Now, that doesn't mean they're going to live for another 10 years, but they're no longer considered terminal within 6 months. Well, it's no surprise to me because what often happens is when you are declared hospice, they stop treating you like a pincushion. They're no longer trying to cure you. Instead, they're making you comfortable. Your loved ones come out of the woodwork. You get to take that cruise you've been putting off for years. Well, guess what? You feel better because you're living again. And then guess what? You get better. So it's not rare that people who are considered hospice patients and terminal are still alive in 2 or 3 years because they went on hospice early. So if anybody ever talks about hospice care and how it's a last resort, my experience as a hospice professional is the sooner you can go into hospice care, the better, because you will probably extend your life, but more importantly, the quality of your life, however long that is. So I think Brian have a question too.
Yeah, actually a couple, but first, thanks. Yeah, very much. It was a very informative presentation. So I guess at the foundation of things, how widespread in the U.S. are people actually suffering or having low quality of life? And what kind of statistics, indicate that we're actually having a problem here, that a final exit strategy, like assisted suicide is helpful?
Well, first you have to define quality of life, and that's different for everybody. So what I consider an unacceptable quality of life, you may think, well, I could live that way. And our position is, that's fine, that's your choice. But I don't think that I have the right to tell you that you must stick around because I consider your illness to not be that bad. So I don't have a clear answer for you. You can go to Death with Dignity organization or Compassion Choices, and they have lots of statistics that are specific to the medical aid and dying thing. We do not keep statistics as to how many people may or may not have used our services. And the other thing is, I can tell you that Derek Humphrey's book is still selling. Every week, he tells us that, people are asking him and people are downloading his book practically every day, but multiple times a week, people are buying his book. There's simply no way of knowing whether they end up using it on their own. Now, I could probably go back and find some statistics as to how many calls we get in a given month or year, and you could probably get that yourself too. But I'm kind of jumping around here because your question is the statistics on quality of life and how bad that is. Like I said, it comes down to, well, first you have to define quality of life, which can't be defined because that's individual.
Right. I guess I know you're saying it's generally subjective, but
right.
Obviously there's some sort of demand for these kinds of services. Right. So, it would be nice to know, whether it's official statistics or at least a general feel that, this is widespread or very uncommon or, that kind of level, I guess, is what I was kind of looking for.
Well, okay, let me address that a little bit, maybe. So there are 10 states plus Washington, D.C. So you got Oregon, California, Washington. They're among the first. Alaska, I can't remember if Hawaii is or not, but now we have Vermont out east. Most of the Midwest, it's not legal. However, I have spoken to several organizations in Fort Worth and Dallas area. For some reason, maybe because I'm in the central time zone or maybe because I went to graduate school in Fort Worth, people know me. But I have spoken to many UU churches, Unitarian Universalist churches, in Dallas-Fort Worth area. And so I know people there are very, very interested just because of how many times I've been there invited to speak on the subject. Yes, Barbara, you're on mute.
Hi, Kevin. I'm curious about the legal ramifications of anybody who might be present, because it seems like there could be, if somebody wanted to be particularly nasty, couldn't they say, well, this person sat there and did nothing? Has that ever been the case?
Unless you are considered a medical professional or what they call a, the name escapes me. But for example, if you called me and told me that you're considering suicide, if I were a licensed therapist, I am required to report that. Okay. However, you as the average citizen are not. And it is there's some really interesting details about that law. That they passed a law here a few years ago. I think it's national, but I would have to check that. They call it the Good Samaritan Law. And the idea is that, and the reason it came out is because if I happen upon an accident scene and I decide I don't want to get involved because I don't want to make it worse, they want to make sure that you can't be sued because you don't know what you're doing. Well, you could have saved somebody's life. You could have pulled somebody out of a burning car. Unfortunately, in our litigious society, I could come in and pull somebody out of a burning car. Well, guess what? They were actually trying to commit suicide. And now you're going to sue me because I gave them a kink in their neck and they've got a crooked chiropractor who will testify. So, and unfortunately, it's not as goofy as it sounds. But so we had this Good Samaritan law that basically says if you stop at an accident scene, you must report it. You're not required to help, but if you do help, there's a layer of protection. So that's one thing. Now, in the case of an actual suicide or self-deliverance, there is no law that says you have to interfere anywhere. The only law is that you cannot assist. So if you want to sit by and watch somebody, now, if you got a politician, I mean, if you have a cop who thinks he wants to be a politician and it happens to be an election year and he wants to make a name for himself, he may very well try to arrest you. He will lose because the law is not there. But meanwhile, your name goes in the paper.
Right.
And so there are some nuances. Every state is different. For example, one of the differences that we have to pay attention to is, depending on the state, are we allowed to remove the equipment afterwards? I happen to be in Minnesota. Minnesota, I cannot. They have a law against, they call it disturbing the death scene. Because, the officials have to show up and they have to look around and say, oh, okay, I don't see any evidence of foul play. But if I remove any equipment, technically it's considered taking something away from the scene, and technically it's against the law in Minnesota and a few other states also.
Thank you.
You're welcome.
Actually, if I could follow up on that a little bit, as far as, I mean, you mentioned during the presentation that suicide isn't illegal, but I think there are ramifications should one choose to commit suicide, like maybe life insurance, perhaps other things. Is that something that you could expand upon?
Thank you for asking that question. Yes, it is a common myth that suicide automatically negates your life insurance, and that's just not true. First of all, it depends on the state, and it also depends on your specific policy. The general rule, very general, so you got to check your policy and your state, but the general rule is that if you commit suicide within 2 years of taking out that policy, so they call it a suicide clause in the policy. So if you end your life within 2 years, but it may be different, it may be a year, maybe 3, depending on your insurance company and the state you live in. So if you commit suicide within a year or 2, then they question why you took the insurance policy out. So that's what you're referring to, Brian, I think. But in general, if you had insurance for the last 10 years and you've got a family fortune or whatever, no, that you committing suicide does not automatically negate any kind of insurance or benefits.
And I don't know if you could elaborate specifically. I think most of us are Pennsylvania residents. Is there anything in particular that would limit Pennsylvania physician-assisted suicide? Or I know there are mail order asphyxiation kits and things like that.
Well, we have to be careful about the word asphyxiation because a lot of people think that that's what Final Exit Network does. So let me elaborate on that just for a moment. If you buy the book Final Exit and you go to the page, it shows a drawing of a guy sitting in a chair with the plastic bag over his head. Well, that's a very disturbing looking picture. The fact of the matter is, what you do, we call it, you're creating a hood. And the analogy that I come up with is like a deep sea diver's helmet, but it's simply made out of plastic. There is no asphyxiation because, first of all, nothing is touching your face. It's actually out quite a ways. But asphyxiation comes from 2 things. Number one, it's a buildup of carbon dioxide in your body. Okay? So you just need to keep breathing. Well, by having this hood, the carbon dioxide is allowed to escape because it's not airtight seal or anything like that. So what you're doing is you're letting the carbon dioxide go. And so there is no carbon dioxide buildup, but also you are still breathing. And so the medical term actually for, I shouldn't call it a medical term, but asphyxiation, the doctors on our medical evaluation committee actually call it air hunger. You know, it's the feeling of I can't breathe. Well, that's called air hunger, and asphyxiation is part of that. There is no experience of air hunger because you are still breathing. You're simply breathing pure nitrogen rather than 87% nitrogen. And so there's never any feeling. In fact, I probably should share this. Years ago, when this method was brought up, and one of the reasons it's still the preferred method, 2 guys actually tried this. There might have been 3, but one guy would put the thing on his head. He would take a couple of breaths. He would go unconscious, and then his colleague would pull the hood off and say, oh, and then wait for the guy, come back and then say, okay, how was that? Was there any pain? What, they went through this several times, and the guy said, there was no pain. I never had this feeling of air hunger. I never felt starved. There's no problem. So there are 2 things that people will often talk about. And I mentioned the educational visit. So we will, during the educational visit, we will go through it. You will actually create your kit. You will put the hood on, and then you will turn the valve, and you will take 1 or 2 breaths, and then you will take the hood off. And then I'll say, okay, how was that? 2 things are the most common thing they report. First of all, you hear the gas coming in. And so there's some people are not expecting to hear anything, but there is a sound, you can hear. It's like somebody opening up a water faucet. You can hear that happening. And so we will typically say, okay, these are the things you might experience. Number 1 is you might hear something. That's not your hearing or your brain something. That's actually the sound of the gas coming in. So that's normal. The other thing is that people, sometimes the gas is slightly cool. Well, that's because it's coming from a tank, and it's sealed tank. And so that'd be no different than blowing oxygen on you from a tank. The oxygen is probably going to be cooler than the air temperature. So the nitrogen may feel somewhat cool to you. And the other thing is some people have reported a slight odor. Well, nitrogen actually is completely odorless. And the people who developed this, they couldn't figure out where the heck this odor was coming from. And they finally figured out it was from the tube, because you connect your hood to the tank through a silicone tube. And depending on where you get that silicone tube, it might have an odor to it. So they might hear the gas. They might feel a little bit cooler, but it's kind of like just a cool breeze on a warm day. And then they might have a slight odor. So that's the background. Now, sorry, I totally forgot what your question was.
So I guess, again, specific for Pennsylvania, what would be a typical path to either obtaining a kit, or would we need to arrange for residency in another state to pursue?
Right. Okay. And I apologize. It didn't occur to me to check your state. However, I can tell you that I have been to Pennsylvania, and we have had final exit clients in Pennsylvania who have chosen to use our services. I'm pretty sure Pennsylvania is nowhere near legalizing medical aid in dying. And so I don't think that's going to be an option for a while. And so, yeah, you can always go to the book. You can buy what you need, and you can do it all on your own, or you can call Final Exit Network, and we'll call you up and see if you qualify, then, we'll show you how it's done. So yeah, I don't know specifically now. If you want, tell you what, Bill, right after this call, I will specifically go and look, because I do keep a record as to what's going on in the different states about laws about, disturbing a scene and this, that, and the other thing. So I will follow up with Bill, and then he can share that information with anybody who wants it to.
So then generally, just to kind of follow up on that, so like for that Pennsylvania case, the typical, I guess, current protocol would be you meet with them and then you get the buy-in from the family, then the final exit people would leave, and then at their own pace, the individual and hopefully the family would implement the final exit.
Right. It's up to the client whether or not they want us to be there for the exit. Also, something that we want to make sure is that there is what we call a discovery plan, because quite frankly, we don't want your body sitting around for a week with nobody knowing about it. And so there needs to be people involved in discovery plan, and preferably within 24 hours. We generally recommend no sooner than 2 or 3 hours, because if it's much sooner, then some overzealous 911 guy is going to try to restart your heart. It won't work, but they'll do it, and then they'll bill you for it. A typical discovery plan is, maybe let's say we're there in your home and you exit, we leave, but we have already talked with the person who's going to be showing up 2 hours later. Or they're going to call somebody, say, hey, I was supposed to have lunch with Kevin and he didn't show up. Can you please go check on him? That happens a lot in nursing homes where they have staff there. So the discovery plan needs to be part of the process, because we need to know that you have made plans for somebody to follow up. And it can't just be that you sent somebody a letter, because they may never have opened it. We need to know that somebody is going to be involved in this discovery plan so that the proper things can be done. Yes, Roger, you're on mute. Still on mute.
Okay.
There we
That's
go.
better. There we go. So you mentioned in a nursing home, can you walk in with this apparatus? Are they going to stop you at the door?
Well, first of all, we don't walk in. We don't bring anything.
Anybody,
right,
period,
right.
just walk in, carrying
Yes.
canisters and et cetera.
Yeah.
What do they think about that?
Thank you for catching me. It depends entirely. First of all, it comes in just a regular box, like you're ordering if you were having a birthday party in your home and you order a tank of helium from Party City, it comes in a cardboard box. Same kind of thing. So all the stuff would come just like you're ordering from Amazon. And then you would assemble it in your home. So nobody, like if you have a guard or a registration desk or something, all they would see is that you got a package. That would be the only thing. However, you do raise a very good point. And I said nursing home, but I was thinking the broader term of just high density housing. So apartment buildings, nursing homes can be tricky, especially if they have a true nursing staff that checks on you. We do ask our clients, do you live in a gated community? Do I have to sign a log that has my name on there? Are there security cameras? Now, none of these things will disqualify you. They just may change how we do things. I don't come in the front door and say, hey, I'm here to help Mrs. Johnson die. I'm not going to do that. But as far as I'm concerned, nobody needs to know other than Mrs. Johnson and her immediate family. In my opinion, it's not the church's business and it's not the government's business. It's your business. And that's kind of end of this discussion for me.
Thank you.
You're welcome.
Judy has her hand raised. Judy?
Oh, hi. Thank you very much for this discussion. I have two things. One thing is an experience I had many years ago in a dental office where I nearly died. And the reason was that I was getting the nitrous oxide, or exactly what they use, and there was 2 tanks. The nitrogen was supposed to be mixed with the oxygen, And, so that when you had to work, you didn't feel it, but, you'd come back. But anyway, they had a problem and the oxygen was not being released. So I was getting pure nitrogen. And all I want to tell you is it was very peaceful. I didn't have any issues. I was just, I went to sleep and that was it. So I don't have any fear of doing anything like that. And the other thing is, you said that suicide is not illegal, but I've heard of, somebody's looking like they're going to jump off a bridge. The police come, people, call the police and they come and they do take the person to emergency room. My first career, I was an RN, and we would get people in the emergency room that the police brought in because they were suicidal. So that's my two things.
Right. Well, yes, that second thing, it's a bit of an oxymoron in our society. I have heard arguments, usually from the Catholic Church and others, that just the fact that you are having this conversation to them proves that you are suicidal and therefore mentally ill. So there's that. And yes, if you do something that injures yourself, they will take you to the hospital. Now, if you try to kill yourself with a homemade kit or whatever, and somebody happens upon you, like an emergency worker, yes, they are required to intervene. There's this little known thing. Suicide used to be illegal. In fact, it's still illegal in a couple of countries in the world. But what people don't know is, why was it ever illegal? The reason it was illegal is because back in the day, you did not own yourself. The king or queen owned you. You were a peasant. You were the property of whoever owned the land. You killing yourself wasn't the problem. You killing yourself, the fact that you took your own life was not a problem as far as the courts were concerned. The problem is that you stole property from the king because you belong to the king. You're no longer able to work the field. You're not going to be able to pay your taxes. So, in fact, a few years ago, I was watching reruns of Boston Legal, the TV show, and you'll see this on a lot of legal dramas where they refer to the state's interest. And this particular episode had the guy playing the character saying, it's in the state's interest to keep people alive. Well, my question is, why? Why does the state care whether I live or die? Dead people don't pay taxes.
Yeah.
That is the state's interest in keeping you alive. Pure and simple. And the church, now they claim that it's against the scriptures or blah, blah, blah. But what people forget is that back in the day, the church and the state were the same thing. The church existed because of your taxes. So it's actually the same person or the same purpose. Originally, the reason suicide was considered illegal and the reason why the church didn't want it is because then you couldn't pay your taxes. That's it.
Mm-hmm. Interesting. Thank you.
You're welcome.
Okay, we have some comments in the chat.
Okay.
Kathy had said she attended a lecture series and a physician from Lehigh Valley Health Network said that in PA, you must specifically write that you do not want a feeding tube. Yes.
Again, that's your advanced directive. There's also something called a POLST. It's an acronym. It's POLSD. It's Physician Order. I can't remember what it stands for, but POLST actually is a little bit stronger than an advanced directive. The difference between the two is that you can write an advanced directive anytime you want to, and it's a broad covering everything. A POLST is a very specific medical order from a doctor about your current medical condition. Now, the advantage of a POLST is that it is a medical order. It must be followed by any medical profession. An advanced directive a doctor in another state may argue with you, and they may not necessarily follow your advance directive, but they are absolutely must follow the directives of a post. And thank you. You reminded me of the chat. I see. Thank you, John Newman. There are 2 of us here, so I had one. So I guess there were 18 people there today.
21 plus Martin joined late, so I guess
okay.
22. Yeah,
So
there was
3.
one feed with multiple people.
Okay, so I'm going to. Somebody asked a question about life membership, which is $750 for couples. Yes, FEN is a 501c3. It is organized. The paperwork was actually filed in Tallahassee, Florida. What percentage of people change their mind? Wow, no one has actually asked that question. I can only tell you that I have been on several instructional visits, and we did not go back for a final exit visit. Unless I want to scour the internet for an obituary, there's no way of me knowing whether they changed their mind or they simply didn't want us to come back. There have been people who, by the way, who did change their mind once they had the equipment. What usually happens actually is it's the societal stigma around suicide. And when people change their minds, it's usually when they find out that they happen to live in a state where it's illegal to remove the equipment. So 2 things, it's illegal to remove the equipment, and they don't want their family to have to deal with the suicide. That combination of things will sometimes when people say, no, I can't do that because I don't want my family to have to go through, the stigma, and I don't want to put them at risk for being arrested if they remove the equipment. So that's usually when people change their mind, is when they find out that their family, nobody can remove the equipment without potentially risking problems. We have Kathy asked, would I be willing to give a presentation at a break forum? Absolutely. Okay, here we go. My personal email address is kevin@kevintbradley.com. That's my website, kevintbradley.com. So anybody is welcome to invite me to do a Zoom presentation for any other organization. And if you forget that email address, Bill has it. Kathy, can you leave hospice and re-enter? Yes, you can. Absolutely. Hospice, in fact, it's specifically for 6 months. And so let's say you go into hospice, you went in 2 days ago, a week ago now, December 1st. 6 months from December 1st would be what, June 1st or May 1st? Yeah. They would have to come in and recertify you for the next 6 months. So it's not about can you leave and re-enter, it's whether or not you can stay. From a legal and Medicare perspective, you have to be recertified every 6 months in order for Medicare to continue paying for you. And then, and I don't know the details about this, but if you're a hospice patient, and let's say you're 6 months, a year and a half, 2 years, and that's not all that uncommon, your hospice doctor needs to then be prepared to explain to Medicare why you're on hospice if you're still around for 2 years. So that's the answer to that question. Thank you, Bill. I could have typed that in if I'd have thought about it. Yes, Kevin@kevintbradley.com. Can you voluntarily leave what? Hospice? If that's your question, yes. You can decide at any moment, I don't want hospice. Just like you can tell your doctor, I don't want you there. Nobody is required to be on hospice any more than you're required to be in a hospital.
Can I ask a question?
Yes.
Okay, I'm trying to formulate it in a concise word again. I haven't been able to, so it may be mildly rambling. You perform your own assisted, and the ideal place to me would be at your home. But you may be in a nursing home, you may be in someplace else where you can actually make this happen. A hospital, I think, would be pretty impossible. So let's not talk about that. But in the ideal place, you're at home, you get the equipment, you've been instructed, everything goes well. First thing is, I have a family friend who removes the equipment. The next thing, somebody has to come and take the body away. You have to contact some authorities, because the next thing is, what happens next? Is it going to be, cremated, buried, all those different steps? But then a death certificate has to be written up. And they want to know the cause of death. Can you address that? How is, if that equipment is gone and your body's there, and your family friend calls some authority group, whether it's an EMT or whatever, what happens now?
Okay, thank you for asking the question. Yeah, so first of all, the absolute easiest thing is if you are a hospice patient, because then if you die, nobody's surprised.
Okay.
But the other thing, I used to be, as I mentioned, I used to be in hospice, and I was specifically in home hospice. And so, yes, there are organizations that there's a place you go to, the hospice building, but the word hospice actually in the United States, it more specifically refers to the fact that you have been declared a hospice patient. It's got nothing to do with where you are. So it's very common for people to have hospice teams come into their private home. Well, one of the first things the hospice team will do when you start hospice care is they will very clearly say, okay, as long as you are our hospice patient, do not call 911. Call us. And there are two reasons for that. One is they don't want to incur extra expenses, because if you're dead, there's no reason to call the ambulance, because then your family gets to pay for the ambulance ride. But the other thing is, it's a common myth that once you go on hospice care, you can never go to the hospital again. And that's simply not true. A lot of people are on hospice and they're old and frail, and they may very well fall and break a leg. Well, you're allowed to go to the hospital to get your leg fixed. That doesn't mean that you're not still technically hospice. It's just a lot easier if you coordinate that visit through your hospice team, because you got a doctor, a nurse, and all those things. And it's also entirely possible that they can treat your leg in your home. You don't have to go to the hospital. So it being a hospice patient, they just tell you routinely, don't call 911, call us. And in fact, I have personal experience where you will get faster service by calling hospice than if you call 911, because 911 is for everybody. The hospice is just for the people who are on hospice, and their phones are manned 24/7. So, but getting to your other question about what happens next, yes, somebody will be instructed or will need to call somebody. Now, if you're on hospice, they would simply call the hospice team to say, we got here, it was our Sunday dinner with Dad, we got here, he's gone. Okay, the hospice team says, okay, we'll take care of it. They call the funeral director, and because you're on hospice, no one's going to call the police, unless there was some reason to suspect that somebody wanted you to die 2 weeks early because they wanted your 47 Chevy. So unless there's some, if you're in hospice, they usually have a social care or a social worker who has visited, they've made sure that your home is safe and all the normal things. So unless there is a reason to think there was foul play, the law enforcement, they will not call the police or emergency or a hospital. They will simply call the funeral home, and they will come and take care of your body. Now, if you're not on hospice, it gets a little bit more complicated. Then it's a matter of whether or not people are going to be surprised. Well, what we will, if you were my patient, I'm sorry, I shouldn't use patient, goes back to my chaplain days, but if you were my client and I was your senior guide, my request to you would be, okay, you're going to set a date. Let's say you're going to decide you're going to die on New Year's Day. Okay, so between you and me, every day for a week beforehand, I want you to complain to somebody different as to how bad you feel. What you're doing is you're setting the stage so that when they say, oh, you know, he did tell me last week that he was having a hard time breathing. We have had a number of clients who, you know, they try to put on the happy face. They don't tell people how sick they really are. And then people are surprised when they die, even if they died of natural causes. And so we just want to look at that from the other direction. How can you best prepare people so they're not surprised? So if they're not surprised, number one, you were sick. Number two, you were telling everybody how bad you felt. And so whoever comes in and says, oh, I came from my weekly cribbage game and looks like Kevin died in his sleep. Okay, now those are all things if the equipment is removed, because there's no indication of how you died. Frankly, I would prefer the equipment stay there, because I would really like you to be making a statement that you did this on your own and damn it, there's nothing wrong with it. Because I'm on a personal mission. I want to get rid of the suicide stigma, because I don't think there's anything wrong with it if it's your personal choice. But that has to be your decision between you and your family. So if everybody is okay with you having done this, leave the equipment. That's the cleanest thing, because then the authorities show up, whether it's the police or funeral home director, they show up, there's the equipment. In fact, what we ask you to do is you will write a note. If you happen to have a copy of the Final Exit book, you would leave the book right there. People show up and go, yep, seen that before. There's the hood, there's the tank, there's the book, there's the note. Nothing more for us to do here. And then they simply call the funeral home. Did that answer your question?
Yes, pretty much. Okay. Well, so what about that death certificate part?
Funeral home will take care of that.
I mean, what? No, the cause of death was my question.
Oh, well, you breathe nitrogen all the time. So there's, it's not like they're going to find poisoning or something, because you're just, they're going to see that as the, I forget her name, the one who commented about the dentist, nitrogen is just there in the air all the time. So you weren't poisoned. You chose to deprive your brain of oxygen. That's the cause of death. Now, they may very well write suicide, depending on your individual coroner. They may write this person was a suicide. But if all the equipment is gone and they don't know, first of all, law enforcement will not perform an autopsy unless there is evidence of foul play or a family member requests it. That's universal all through the country. So no, people aren't going to do an autopsy just to try to figure out how you died. They will not do that. First of all, it's expensive. They don't want to waste their time. So if law enforcement shows up and it looks like you died in your sleep, they're going to assume you died in your sleep, and they'll call the next of kin. And presumably your next of kin will know your wishes anyway, and they say, yeah, okay, thank you. And then they call the funeral home, and just like you died, natural causes.
So Kevin, you mentioned in your talk that, if someone came to you requesting Final Exit Network's help, and you thought that they weren't sound of mind, you would refer them to, get help. So I'm curious if, how at odds is your organization with, suicide prevention groups, and is there any friction there?
Yes. I won't necessarily call them for you, but what I would do is to say, well, have you talked to a therapist? I don't necessarily, no, actually, if you go to our webpage, I believe it's right front center. We are not a crisis hotline. So if you're going through a temporary crisis, please call 911 and they'll take care of you. So that's on our website. So I don't currently serve as on the front line. So if you were to call our main number now, I would not be one of the people answering the phone. But I do know that that's one of the comments. They get calls from people saying, I don't know what to do, blah, 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 blah. They will say, call 911, or they will refer you to a crisis hotline of some kind. I'm sorry.
No, I was just talking to my son. Sorry.
Oh, okay. So yes, but it's a bigger part of your question is, do we have tension between some groups? And yes, we do. I mentioned the Catholic Church. There's also this organization called Not Dead Yet. And that is a specifically organization that they think that they are advocating for the rights of the disabled. But actually, the Americans with Disability Act people, they like what we do. Because no, I mean, if your 12-year-old child is in a wheelchair, no, I'm not suggesting that we do anything to end his life. However, if you, as a mentally capable adult, are confined to a wheelchair and you consider that an intolerable quality of life, that's your choice. So the tension there is around any group that would call itself pro-life is more likely not agree with what we're doing. And so I just figure, well, if you're a member of that group, you're not going to come looking for us. We generally actually, we have sort of shifted our mission to some extent. A few years ago, we were more on the persuasion thing where we were trying to convince people that what we do is okay. But the more people that we talked to, the more we found out they already know that. They just didn't know we existed. So now our mission is simply to let people know that we're here. So it's about raising awareness, because either you like the idea or not. If you don't like it, fine, you're on your own. If you do like the idea, contact us and we'll see if we can provide some sort of resources. We're very careful about, we don't like to say that we help you, because somebody somewhere might be recording that and say, see, you helped them die. You're guilty of assisted suicide. So we try to very carefully say, I directed them to the resources that they asked for. Now, I will tell you that I mentioned our legal cases. They tried to shut us down in Arizona and they tried to shut us down in Georgia. We won both of those cases, but they also tried to shut us down in Minnesota and we lost. And the reason we lost that case is because there was an overzealous prosecutor who was running for office. But also they decided that in the state of Minnesota, if I sent you, and let's just say, for example, if you said, hey, I'm thinking of ending my life, can you tell me how? And I replied to your email with Derek's website, and then you bought the book and you committed suicide, I am guilty of assisting suicide because my speech enabled you to do that. Now, we think that's ridiculous because we think it's about free speech. The key is Derek's book is available in libraries. It's in the bookshelves, on the bookstore. You can go there and buy all you want. So if you went into a library, found the book, went home, no problem. If you went into a bookstore, bought the book, went home, no problem. Ordered it online from Derek because it's freely available, went home, no problem. The question is, if you go to a bookstore and ask the clerk, where can I find this book? And you tell them you're thinking of killing yourself, and then they tell you, yes, you can find that book over in aisle 10, that clerk is now guilty of assisting suicide in the state of Minnesota. It's ridiculous. I was in court several times. Our lawyer was in court several times. And it finally got to the point where we just gave up because the next step was going to be the Supreme Court. And let's just say that the current political climate does not look like it's favorable for that going towards Final Exit Network. Now, I have actually, this is kind of a tangent, but I've actually been pleasantly surprised. Some people in Final Exit Network were just very angry that Neil Gorsuch was going to become on the court, and then Kavanaugh, and then now with the most recent one, but specifically with Neil Gorsuch, because he literally wrote a book about the future of assisted suicide. Very popular book, well-researched book. You know, he has a first-class legal mind, or he would never have been a judge to begin with. But everybody was freaking out because Neil Gorsuch was going to be in the Supreme Court, and everybody knew how Neil Gorsuch felt. Well, the fact of the matter is, Neil Gorsuch has actually, his rulings have actually been more along the lines of individual liberty. And likewise with Kavanaugh. And so just because somebody has claimed to be Catholic, pro-life, or whatever, it turns out that's not necessarily how they rule as a judge, whether it's in the Supreme Court or anyplace else. I actually think, and you may be angry about this, but one of my favorite justices was Antonin Scalia. And it's not because of his beliefs, it's because he did not allow his beliefs to get in the way of him ruling on court cases. And also, I'm a writer. And he is widely regarded, including, by the way, Ruth Bader Ginsburg publicly said that as far as she's concerned, he was the most qualified Supreme Court justice to ever have been on the bench because of his mind, and specifically his command of language. I read a book here called Nino and Me, and it was written by Scalia, or about Scalia really, by a lawyer who co-wrote a book with him, and then wrote another book about their relationship. And that's when I really started to understand, because he would have these conversations about, you know, Justice Scalia, I'm really surprised that you ruled in this because it clearly violates your Catholic faith. And Scalia very clearly said, when I put on that robe, I'm not Catholic. I'm a Supreme Court justice. And I thought that spoke volumes to me. But anyway, that's kind of a tangent. So I don't see any more questions coming in. So, oh, wow, it's coming up on noon here in Minnesota. So 1 o'clock there. Oh, we have one more question yet?
Slightly, it just pertains. I was thinking about, you were talking about the person having to do various physical functions on their own regarding the tank. I know in a lot of hospital situations and places where it's physically people are handicapped, the faucets on and door handles are levers. So the faucet is not a turn knob. The faucet is a lever that you can move. Could you put that kind of a handle lever on the tank? Do you think that you do? Have you ever looked into that so it's easier to open?
Yes, people have done that. You could easily turn the valve with a vice grip or something like that. Sure, it really comes down to is, can you do it, or can you figure out a way to do it? Because I'm not going to help you.
No, that's right. But some people have a lot of, atrophy, I guess, at old age and stuff.
Yep.
And
yeah, if you've got rheumatoid arthritis or anything like that, then, that's why we say, can you open a new jar of jelly? Well, people who have already figured out ways around their arthritis, they say, well, yeah, I can, but I just need to use this device. Okay, fine. Then use that device. That's fine. It's just that I can't open the tank for you. You have to be able to open the tank on your own, however you do that.
okay.
Looks
Very
like we've
good.
lost quite a few people have dropped off here.
Yes. If there's no more questions. All right. Another thank you to Kevin. That was very interesting. I didn't really know anything about it. I found the part about nitrogen being used as a very painless.
Yeah.
Thing.
So what did we end up with total count? Do we have about 25 or so?
22.
22. Okay. So again, you have my email address. We invite you to become a free member. For 1 year, you will get the quarterly magazine. And then after that year, somebody will ask you if you want to convert, to the whopping $50 thing. But also, please, I invite anybody to subscribe to the blog. And I usually post a blog entry once a week. So, and that's always, you can opt out of that anytime you want to, but you need to go in and subscribe, because I don't believe in doing that for you, because I think it needs to be your decision. So you need to come to the Final Exit Network website, find the blog, and subscribe.
I do have a question. Maybe
Yes.
it's for John. This has been recorded, and it'll be up on the YouTube channel. I got half a dozen people I wanted to see this. How do we count if I do get people? Is that, and do we have to? Do you have an additional count way of calculating it?
Yeah,
I'm not that concerned. I'm really more reporting how many people showed up today. Now, Bill, if you happen to know, let's say over the next 3 weeks, people came out of the woodwork and there were another 20 people who watched it, I would be personally interested in knowing that, because that would actually be helpful information to have. And this is sort of a holdover from the fact that we used to go out and we would simply count how many people showed up. Nowadays, with everything being recorded, unless someone tracks that information, we can't keep track of it.
So Kevin, are you okay with this being on YouTube?
Yes,
Okay.
I hope.
Thank you.
I'm thinking back to see if I
Anyway,
said anything I
got the floor for a little bit here. I work in an industry that deals with compressed gases, and there's plenty of ways to hook things up. You may have to buy some parts, but you can buy valves that are significantly easier to open than the one on the top of a tank. So if someone can figure that out, they can make it pretty easy, physically easy to open.
Thank
I'll
you.
keep you in mind.
Well, no liability here.
Thank you, Kevin.
All right. Thank you very much.
Thank you.
Thank
I'll send you
you.
the link then, Kevin, to the video.
All right. I appreciate that.
Very good.
Thank you, everyone.